and other members from our own community to share with another the knowledge of the science so that we can better protect ourselves and stop the spread of the virus. We ask you, Lord, to be with us, to accompany us, to assist us during this time we're going to spend together, so that it will inspire us with your Holy Spirit, so that everything that we're about to discuss or to listen from Dr. Emmanuel, of course, will be from first and foremost from you. We ask this through Christ, our Lord. Amen. In the name of the Father, and of the Son, and the Holy Spirit. Amen.
Amen. Thank you, Father, and thank you for your presence in our midst. We really appreciate you.
Pleasure.
All right.
Thank you. Pleasure.
All right. So we're gonna continue on with a COVID-19 presentation. I will be a moderator for tonight. As I said, we have two speakers, very prominent members in our communities, that will be presenting very valuable information, and also just really these information will be educational and help us engage in when we engage in conversations where people would say things that are based on opinions or things that are not fact-based. At least we'll have that resource to be to refer to be able to engage in that conversation. It is important that we remain informed, and this way we'll be able to do the right decision, whether it's taking the vaccine or continuing to take precautionary steps and wearing masks and just staying 6 feet. Whatever it is important to be informed. So I'm just going to share just the current stats of COVID-19 at the moment with you guys. As of today, the cases in the United States is 30.2 million, and we have 548,000 deaths currently in the United States. And New York, the numbers in New York is 1.84 million cases with 49,000 deaths, with a good amount of concentration in New York City with 830,000 cases and 30,000 deaths. So these numbers are staggering, and we do acknowledge these numbers, and us at Laraka, seeing how that is, we took it upon ourselves to really make this presentation and share as much information we can with our community members in order to really stay protected and stay informed. So we have two speakers tonight, as I stated. I will introduce the first speaker, which is Dr. Guy Aristide. Just a brief bio on the doctor. He is currently a director of medical in the ICU at St. Francis Hospital. He is a philanthropist and entrepreneur. So we do have some heavyweights here that are speaking tonight. Just a brief description is he is a board certified physician in internal medicine, pulmonary medicine, and critical care medicine. As I stated, he's the director of ICU at St. Francis at the Heart Center in Long Island. For his education, he attended Long Island University for his undergraduate studies. He then followed that at SUNY Downstate, where he made his residency, and that was succeeded with his fellowship at NYU Winthrop for pulmonary critical care. Dr. Aristide is also a course director of critical care ultrasonography at the Northeast Chapter Society of Critical Care Medicine. And as an educator, Dr. Aristide is the co-director of stimulation education at the CLES Center, and he's an associate professor at NYIT Health Sciences Department. As I stated, he's also an entrepreneur, so we have a man of many things among us. He is the founder of a company called N8 Concepts, which is a boutique firm focused on medical equipment innovation. And one of the innovations is his own invention, which is the Omni Hospital Headboard. One thing that Dr. Guy Aristide is doing that is really effective is that he's engaging in activities to impact his native country, which is Haiti, in the sector of healthcare, education, and entrepreneurship through the implementation of up-to-date branding and technological resources. And to add to that, the presentation that we're going to be seeing from him tonight is a presentation that he's gone across the country to present to, from local officials to state officials, two of which he presented this material to the mayor of Plano, Texas, and also the mayor of Dallas, Texas. And recently, he has presented that to through the radio waves and prominent radio station in New York, which is Hot 97. So definitely, we are privileged to have him here, and we are privileged to be able to really witness his presentation. So I do invite you guys to really pay attention. If you have a notebook, definitely take out your notebook to take notes, and we will be taking questions. We do have a Q&A session at the end of the presentations, which is, we do have two presentations, Dr. Guy Aristide and PA Gillian Aristide. So we do ask you to hold your questions. If you do want to ask it, we are opening to chat, so you could type it in there. And once we do the Q&A session, we'll start with these questions and also any live questions that we may have at the moment where we're starting the Q&A session, we'll be responding to them as well. So I do invite you guys to give a warm welcome to the doctor. That's a son of the community in Brooklyn. He is established in Brooklyn and have learned, going around the nation, and has brought us an information that he will be sharing, valuable information. So please help me introduce Dr. Guy Aristide.
Thank you for having me.
Ooh.
Can I share the screen?
Sure, yeah, you can. Are you able to?
Yeah, I'm doing it right now.
Okay, great.
Can you guys see it?
Yes.
All right. So, Emmanuel, thank you for that warm welcome. I definitely feel like I'm home. It's been a very crazy and tumultuous year, as many of you could attest. I applaud you guys for doing the right thing, for staying in prayer, for being supportive to one another throughout this entire time. And one thing that I try to share whenever I give this talk is for us to kind of keep in mind up to now, the 548,000 people that have died. When we think of ourselves, try not to do it in isolation, but trying to think of them, that they could have wished to be here to experience some of the treatments, to have ample warning when the virus first came down. Because for many people that got sick, it was just a matter of being at the wrong place at the wrong time when they didn't know to start wearing a mask in February, in March, right? And so, it's one of those things where, we're unique, but we're not that different. So we just have to try to, be open to that mindset. So as Emmanuel mentioned, the main purpose of giving this lecture throughout this entire year is I try to give it, as many of you are, leaders in your own right, within your community, within your family. And so it's always important to always empower leaders because there's so much misinformation that's out there, and there's so much lack of understanding and patience that occurs. The main thing that we can do is just inform people, be patient with them, don't discard them, even if there's a point of disagreement, because at some point they will come around. Because their experiences is often determined by what information, what things they've been exposed to. So that is basically the purpose of this talk at this point. And so I'll just get into it, and I want this to be informational. Feel free to kind of ask questions to kind of make it open. This is very visual. I'll just give some background as we go forward. Okay, give me a second. All right, so as we kind of mentioned, just some basic facts about COVID-19. Essentially, it's a new clinical syndrome that started in late November, December, as facts that we kind of know from what occurred, over the past year. Primarily, it is a respiratory illness, and I'll explain that a little bit better, where it just attacks, the respiratory system, gains passage, primarily to the nose, but can, be impacted. It can impact our body through contact as well. And so one of the main things that has been a tremendous problem is managing the respiratory failure, right? And we're trying to kind of go through that and just kind of explain exactly how that comes about, okay? And so the COVID, it's what they refer to as stranded RNA virus. And what that means is kind of like a precursor to what DNA is, where so it allows it to be able to adapt quickly and make change. And the host being us, any live human person being able to kind of do that, that's how it will kind of gain access. And so just keeping in mind that as we kind of go around, that the SARS, which is the COVID coronavirus, there's different subclasses. It's almost as if it's saying, if your first name is John, there's many Johns, right? But it's just there's no John Aristide, there's no John Pascal, et cetera, et cetera. So when you hear of these new strands, it's essentially where it occurs from base virus, and then they just either modify and kind of cause issues. I try not to get into what's out on social media, how it started, and think about what happens when it's at our front door, primarily when it's impacting Black and brown people, and we're the ones suffering the most, right? We were the ones without, excess reserve in our bank accounts, and we were the ones mostly dealing with people face to face. And so that makes it very difficult for many of us to not have that choice of being away. So we need to be empowered. And so the first virus that actually occurred was back in 2002, when it was the SARS virus, which is the first one. And that one also caused like a respiratory illness as well, where many people went on to needing ventilator support and also needing additional support. But at that point, it was not as virulent. Virulence means how intense, how dangerous the virus can be. It was not as virulent as this type of virus is. And then subsequently, about 10 years later, there was the MERS virus, which is basically also coronavirus, but basically was the origin of it was from, the Middle East, primarily near Saudi Arabia, Jordan, Yemen, and so on and so forth at that time. And so when we think about it, typical clinical presentation for somebody with COVID is roughly about 2 to 14 days, right? And that is basically, you kind of come into contact with someone. And that is the reason why it's very important for one to be vigilant of potentially when you may have gotten exposed. And if you think you were exposed, and that is the reason why there was such a big push to trying to get as many people tested as possible. So the mindset of saying, hey, I don't want to know if I have it. Well, the problem with that is if you see 12 people in the meantime until you start getting symptomatic, you may actually end up being okay. But maybe 5 out of the 10 people you came in contact with potentially could, succumb to the virus. And that is why when our ineffective leadership at the time was saying, well, the more you test, the more virus you're going to have. That was probably in all frankly, the most uneducated thing, but I can have another adjective to express that, but I won't do that since we're being recorded. But the idea is that you wanna know, and I share that it's the same. So the first part of it is when you start having what they refer to as prodromal symptoms, right? Fever, chills, cough. Many times people can just have a very common cold-like symptoms, and then they kind of dissipate. One of the more well-known symptoms of COVID-19 is basically the lack of taste and the lack of smell. So as a result, that's just there. But just waiting for those two symptoms does not necessarily mean it's anything else, especially if I was to, go in the middle of a war zone and I heard a sound go off, it would be it would be malpractice on my part to think it's a firecracker, right? So if you're in the middle of a pandemic and you're having symptoms, presume it's COVID. And I'll explain why. There's 2 slides why I want you guys to be mindful that the moment you start having symptoms, why it's very important to seek help early, because then it minimizes the amount of the severity of disease that you have, okay? And so this is just basically a slide that reflects the reason why people still feel so violently ill. It is something called cytokine storm. Basically, cytokine refers to like your cells, and what those cytokines are, they're basically like immune cells that come to fight, that comes to your rescue. But what happens is that the virus, because how effective it is to kind of, generate, it's almost as if, when you work with someone or you have somebody in your class that really gets on your nerve, and sometimes it may be something very small, but it causes like an overreaction. And somebody says, wow, God, like, why did you overreact? But it's just so much underlying tone that has just been pent up that causes this big reaction. And so it's very similar to that when you're talking about, the cytokine storm. So you release different type of cells. And the reason why I say that is so now you can have that terminology when somebody comes and say, hey, I was told that I have COVID, but I don't think it's real. Like you can kind of say, hey, how did they describe this to you? What was it that you heard them say? Did they say that was your, or if there's a loved one in a hospital and they say, well, the person's not getting better. So say, hey, what's their inflammatory markers? What's the cytokine storm like? And I'll explain, because there's a particular slide later on right about here that does a great job. So here, if you kind of look here, if you're talking about early infectious phase, right, which is phase 1, then phase 2, which is what we refer to as the pulmonary phase, and then phase 3, which we refer to as the hyperinflammatory phase, where all the inflammation sets in. So the first stop is, first phase is you kind of get exposed to the virus, okay? You have your mild symptoms, your fever, your immune system's like, hey, like I'm sensing somebody came in through my front door, and I'm just gonna have a reaction to it. And that's basically those symptoms that you have, okay? And as you can kind of tell, this vertical line goes, when you go from phase 1 to phase 2, this part is very crucial, because this is where a lot of the misinformation happens, where you find that people, may be at some point in this phase, but they make a lot of assumptions. So what you find here, if you see the blue section, which is basically when you refer to as the viral response, right? This is the big blue section. That's when you get the most viral exposure. So how much virus you get exposed to also determines how much of a reaction you get exposed to. So it's like spending. It's like having money and spending. If you have $1 million, you can spend for $1 million. If you have $10, you can spend for about $10. So if you live in a small apartment where somebody is exposed to COVID, the first day, maybe you got a small inoculation where you got a small exposure. So your immune system really doesn't react as much. But if you're sitting there, like circling that same amount of repetitive viral exposure, your immune system is going to have an exaggerated response. And that's exactly what happened in the spring. Because if you look, most of us living in the city, Brooklyn, Queens, Bronx, wherever, like living in, tall buildings, small apartments, exposed where everything is so densely concentrated, that's where you're going to have a lot of that kind of reaction. And so if you can kind of tell, about 5 days, the viral response starts to kind of go down, right? And then what you're noticing is that at the same time, look, right, the red reflects the pulmonary phase. Now, how much of it starts to impact? That's when you can find somebody, hey, I had mild symptoms, 5 to 7 days, I kick it, no problem at all. Hey, I got the vid, I'm good, I'm chilling, there's no problem. But a small percentage of people will go on to have the actual pulmonary symptoms, which is the respiratory failure, which hypoxemia, the low oxygen level, the rapid respiratory rate, feeling shortness of breath. If you think about it, that is basically when you're starting to have what we refer to as end organ damage. So now it basically means you got infection, then the infection caused the cytokine storm, and it's like calling 911. it may be a small fire in a small little garbage dumpster, but when they come in, they're breaking down doors, the sprinkler systems all over. So the damage sometimes seems like it's over exaggerated, and that's what's happening with the immune system. The immune system is doing a significant damage on the lung, on the sometimes the heart, where young people end up with congestive heart failure, where it leads to stroke. It can lead to kidney failure. It can lead to liver failure. And another symptoms that does occur with COVID is presentation in terms of diarrhea. So if you have viral-like symptoms and you're having diarrhea, that's also a concern. Not as infectious as Ebola may be with diarrhea, but it's something to kind of keep in mind. And so as you kind of go towards the next phase, which is the hyperinflammatory phase, this is basically the point when the inflammation sets into the lungs and it starts to, unlike other diseases, actually cause damage to the lungs, right? And I have some x-rays of actual patients, obviously given their permission, that actually kind of shows what happens with the lung. So compared to now, we're at a fortunate point now where I think the confusion and the background noise, it's actually healthy, but we want to be informed when we're saying, hey, why this treatment? In the spring, there was no proven treatment at all. So it was basically a scenario where many people died because there was not much to offer. And this is why I think the spring was a lot different than now. So in the spring, you know, we were concerned about spreading the virus to medical staff, other patients in the hospital. And I think also from a public health standpoint, it was a dereliction of duty not to emphasize how serious this thing was, because everybody felt like they still need to kind of go about. And so at that point, you have a scenario where people are staying home for 1 week, 2 weeks, 3 weeks, staying home. And what's happening? They go from infection to inflammation to scarring to damage. And so when you show up to an emergency room and your oxygen level, where normally a normal oxygen level is 94% and up, you're showing up with an oxygen level of 68%, what do you do for that patient? And so many times when somebody came in, they got placed on a respirator, that was a need. But then also there was a concern about spreading infection, not knowing how virulent this virus was. So some people got intubated prematurely in an effort of preventing infection. But think about it. I want to be able to say, everything is like a big bell curve, right? There's some people that got intubated unnecessarily, right? And turned out to be okay. There's some people that needed intubation, and there's that middle portion where people got intubated. But if you kind of think about it, if your lungs are damaged and you're not able to breathe on your own, like it's one of those things where that is the issue, right? So even now when you show in and you want to be able to do it, you don't want to say, hey, it's just the ventilator that's causing that. It's almost as if you're talking about, if you have a pump and you're trying to put air in your tire, if there's already many holes in your tire, you can't say it's the pump that caused the holes in your tire, because you already showed up with 12 nails, 12 holes in that inner tube already. So that's the kind of way you kind of want to focus how the lung is being damaged, okay? And so when we kind of get into it, the aspect of it, the lungs get so stiff that it requires a lot of pressure for you to be able to ventilate. And so, you know, whereas in the very beginning, there was, you know, some thoughts in terms of not using steroids. Myself and my colleagues in our institutions were very early to using steroids when we were told not to, because if you think about the physiology, the understanding of it is, it's inflammation. All you want to do is minimize the inflammation to allow people time until their body's able to kind of recover and to minimize the underlying injury that's occurring, okay? And so this is just also another reflection of what I showed before. This, when you're talking about stage 1, this is where the viral response is. And basically the host inflammatory response, the host inflammation is roughly about this early part where I put this big red cross. Here, the very first part of the pulmonary phase. So don't wait, say, hey, if you start feeling short of breath, like don't wait till things get so bad. Because then at that point, like you're not dealing with reversible damage, you're talking about thick scarring of the lung. And there's so many young people that's showing up to clinic now who's 25, 28, 50, 40, and it doesn't matter. And these people have long-standing and will have lifelong lung scarring and will be very limited. So that young person that was in college, probably at this point, is no longer going to be able to be a fitness instructor, is not going to be able to take on certain jobs and responsibility as a result. So it's very important to, one, minimize your exposure, to stay home so you don't get sick. And then two is wear your mask, social distance, because what you want to do, you want to be in that pool that doesn't get sick, right? And if you get sick, you want to be able where before you start having the respiratory symptoms, right? Because even now, and we'll talk about, we kind of get to the treatment, okay? Just in terms of what options are available. And so this point here, this is a patient of mine, okay, that came in. This person was not on a respirator, okay, came in from home after being home for about 3-4 weeks of just the virus just eating at you. The fever, yes, it's kind of a common cold, but this virus is actively doing damage while you're having the fever. So if you kind of look, so in the top upper corner, what you're normally seeing here is the lung is normally, when it's on a CAT scan like this, it's normally like a black color, right? But you see all this haziness and this white, that's inflammation. And so this person, as a result of the inflammation causing so much damage, it caused the lung to just, you know, just spontaneously, just all of a sudden, just pop like a balloon. So a lot of people died because, one, they got blood clots that travel that caused this issue. Secondarily, when you have this collapsed lung, that's another problem that leads to complications. And so this is basically when he first came in, this is another patient. In the bottom center, if you can kind of see where my mouse is, you see this little, you know, sac-like black blebs that you're seeing. This is someone who is not on a respirator, right? And I'm saying this because what I want to do is take away the myth away and just think about the physiology and the disease and what it's actually doing. So these blebs end up causing the lung to kind of collapse over time, okay? And that is very crucial. And so for this patient that actually had, you know, this lung collapse, and we had to put a tube in to kind of decompress the lung to be able to allow the lung to inflate. So if you have a loved one, a family member who's in the hospital, as we kind of talk about it. So first, the conversation to have, hey, how are the inflammatory markers? Generally, we check it every 2 days. Hey, are the inflammatory markers going up or the inflammatory goes down? So if they're on treatment, the inflammatory is going down. That's reassuring because you don't have that ongoing damage that is happening. And the other thing is, if they are on a respirator, you want to ask, okay, are we turning this person, laying them down on their belly, right? And the reason for that is because when they're laying down on your back all the time, all the congestion in the back of your lungs, and gravity pulls blood to those areas that are scarred. So there's no oxygen in those scarred areas and all the blood is going there. So it's almost as if you're spending a lot of money, which is the blood flow, to an area where nobody's doing work. So therefore you're not getting a bank on your return, or you're not getting a return on your investment. So that's basically why we try to turn patients on their belly. And you don't need to necessarily be on a ventilator to lay on your belly. Even if you're home and you're recovering, you know, laying on your belly helps to kind of rotate, you know, the level of pressure on the lungs that causes congestion and collapse. That way it helps to keep the oxygen levels up, okay? And prevents you from feeling too many symptoms. And so this is just another example of somebody else with a collapsed lung. And for this patient, you know, the inflammation was already set, and to the point where this person kept on having this point, and we had to do a special procedure for him where we had to do something called a bronchoscopy to go down the airways and to kind of deploy like a little plug, a little valve that would stop the air from leaking. So it actually kind of helped, and this gentleman actually did very well and went home. And I actually we developed the bomb, and I actually went to his house to visit him. As a Dominican guy, you know, and throughout this process, you develop bonds with people. And I try to think about them as who they were before they got sick. because many times these people, like, they didn't ask for this the way, you know, any other diseases where, quote unquote, people feel, oh, they brought this upon themselves, right? So we need to have compassion even when people are being stupid and not really heeding the guidance, right? Information will kind of get them through, all right? And so what is the preventative measures? Hand washing, use of hand sanitizers, wearing your face mask, because what happens is, as long as there's uninfected people, right, and the virus continues to jump from person to person to person, COVID is going to be with us for some time. When we were in August, when the numbers was way down, you know, we probably could have said at the end of 2021, we would have been okay. But now, when you see we have the vaccine and things are doing okay, and you have states saying, hey, we're going to completely remove the need for masks, like, there's millions of people that did not get sick in the spring and the fall who potentially will get sick now as a result. And so we want to be able to kind of engage and to stay diligent until things get so low that the rate of transmission and the stress on healthcare institutions is not that bad. So we can actually take time to spend with a patient. So if you can imagine in the spring where we had 80 intensive care unit beds, all 80 was full with people who are this sick, how much attention can one person really get? When in a normal time, you may have one person just to stabilize them. They require 2-3 hours to stabilize. So a lot of that, it helps when we do our part in the community where the hospitals don't get inundated with such high numbers, because it's just a matter of triaging at this point. And that's just the reality of it. And so we want to be able to kind of do that so you can actually get the attention that you deserve once you come, because the numbers are not that high. And so what have we learned at this point? And just to kind of go back, the physical distances, as I kind of mentioned, and this is probably the time during COVID to be able, as best as you can, to adopt a modified lifestyle of feeling healthy, right? And so, you know, the word cytokine, a storm that they referred to before, is like cyto means cell, like your body, and a kine is basically the way to describe that cytokine storm. So in this phase, when I encourage people to take better care of themselves, I refer to as cytokine, right? So being kind to yourselves, eating properly, exercising, getting proper sleep, getting your healthy dose of vitamin C, vitamin D, your multivitamin is more than enough, and then just doing the general things, because this is the reason why. If at baseline you have a pre-existing condition of diabetes, high blood pressure, high cholesterol, and autoimmune disease, whatever else it may be, the amount of inflammation in your body may already be, let's say if we reach a scale of 1 to 20. So if you have no pre-existing condition, your base level inflammation is probably at a 2 or 3. So if you get exposed to COVID will take you from a 2 or 3 to a 10, and your immune system and your body can recover and bring you back down to a 5. But let's just say if the range is a 1 to 20, and COVID finds you at a 15 to 18, and COVID takes you, and it takes you to a point now where it's taking you to a scale level of 50. And at that 50, like, your body is just not able to kind of handle this assault, right? Because there's so much, it's not just one organ. So yes, the lung is what caused you to come into the hospital, right? Because everything is like a silent damage. But the moment you start feeling abnormal where you can't breathe, that's what brings you into the hospital, right? But at the same time, your organs are being damaged and other organs are being impacted, but you don't feel those. And so that's not the reason to bring you in. You understand? And so, you know, the long-term impacts of this, we're yet to see. And that's why you don't want to be the one to kind of get sick and wait to see what happens, right? And we'll talk about regarding the vaccine. You know, I'll be more inclined to kind of, you know, act on what I know than be concerned and expose myself to a fact of what the possibilities may be down. We know what COVID can do, right? So if you're gonna tell me, give me 2 options to go into a ring with 2 heavyweight fighters, and you tell me some guy who's just coming up and, you know, he hasn't really proven himself, versus you tell me, hey, you know, this is Mike Tyson in his heyday. Listen, I'm not going in the ring with Tyson. I would much rather go in the ring with this person that hasn't proven himself. So if you think COVID, COVID is probably the most formidable and systemic disease that we've had. Yes, Ebola came in, but you're talking about small isolated pocket. Like this global pandemic has reached, criticals beyond what we've known prior to the Spanish flu, in the early 1900s, right? And so that's something to kind of keep in mind. So currently, part of the approved and beneficial treatment. So let's just put it this way: hydrochloroquine, Plaquenil does not work. Let's just put that on the table, okay? It may work for malaria, but for COVID, absolutely nothing there. When it comes into, just think about, you want to be able to attack in a different way. If the phase 1 is your body's replicating the virus, you want to take antivirals to prevent the replication of the virus. So that basically means if there's 1 million virus particles in your body, we give you the remdesivir to bring that million down to, let's just say, 30,000, 20,000. Now your body has a chance versus getting pushed around left and right. And so as you kind of go down, and the remdesivir was actually created, for Ebola, but an antiviral, the way viruses function, they function very similarly, because what they actually do, they come in, also like the HIV virus, the way they function, they come in and they took over the host's response. So they use your own factory to make their own protein. So basically they move into your house, don't pay rent, don't do anything, just a small bag, but they're using everything in your body to have their own function happening. And so that is something that, the first line is the remdesivir. So currently there are another class of medication called bamiluzumab. So the reason why I say it's very important. So if you do happen to get sick and you get tested and it tells you that you tested positive and you start having fever, by going in and checking your oxygen level, you want to go early. Right now, many emergency rooms, what happens is that you go in to say, hey, your oxygen level is about a 90. You're not sick enough to get admitted. We think we'll be okay, but we'll give you an infusion of the bamiluzumab. And basically what that does, it helps to quench the cytokine storm, the inflammation, and you're able to kind of go home, do those other supportive things, but at least, you've kind of quelled the inflammation down in your body along with steroids, okay? And so if you happen to be somebody with diabetes, it's very important that they adjust your your blood sugar medicines as well. Okay, so this is basically what you want to be able to kind of do, and this is why the early intervention is important, because many times you may actually need and require oxygen. Okay, and as we kind of get to the next point, which is the dexamethasone, which is basically the type of steroids that is shown to kind of show effect and benefit, for many things. And so it is used pretty significant. And what you find is if a patient shows up too late, where they're no longer replicating virus, so basically the anti-inflammation medicines are basically the best bet. And if there's a lot of scarring, sometimes where we give 10 milligrams of a medication, if they're having a lot of inflammation, I've started to, and many colleagues around the country have started to give it 1 gram to fully suppress the immune system down, to be able to buy this person time. And there's data and there's evidence to kind of show we're able to kind of stem the tide of people's lungs progressing and getting worse, okay? And so these are things that we want to keep in mind, all right? And so, when we kind of talk about it, right, we as people of color, we always, have people deprive of us of information. And as a result of being deprived of information, we allow people to make us feel as if we're victims. No, throughout this entire experience on Earth, like, we've always been at the forefront of ingenuity, always been at the forefront of the best and the brightest thing that's happened, all throughout. So when we talk about, the mystery about vaccine, yes, the Tuskegee experiment was egregious. It was horrible, but that was one evident. But it doesn't mean that we cannot educate ourselves. We cannot inform ourselves to be able to make informed decisions about our point. And this is this gentleman here, Onesimus, okay? He was an African slave, migrated to Boston in the early 16 to 1700s, okay? What he was noticing was back in Africa, when people would get sick, they would make a small cut, take some of the, obviously, you know, there was no HIV, hepatitis C back then, and people would get eaten by lions and stuff like that. So they wouldn't die of those long-term diseases anyway. But the idea is that they would expose other African tribe members to the sick person's bodily fluid to kind of boost their immune system. And so at the outbreak of the smallpox, he actually, as a slave, his slave master saw him doing that among the slave on the plantation, and they took that. And that's basically the start of, you know, the use of vaccination in the Americas, okay? So we are not victims. We're bright, we're very intelligent, you know, people, and we're not victims. So we wanna be able to kind of, if something doesn't sound right, we're able to kind of look and seek information and entertainment in other ways. Don't act as if you can't go and read just as intense at the CDC website as other trusted to get the information you want. Because if you want to know what Cardi B is doing, you're doing it and you're finding that information anyway. Sometimes better detectives than the FBI. So I just want us to kind of get into that mindset as leaders to be able to kind of share that with our own people, to kind of take them out of that mindset of victimhood, empower yourselves and be a formidable foe for people that may try to, you know, allow you. Because at the end of the day, when everybody's saying open up, who's the home health attendant? Who's the restaurant worker? Who's the bus driver? Who's the train? It's us. And so everyone's saying, you know, come deliver my goods, but you're in the front line. So you have to be empowered. You understand? And so that is basically that. And so before we get into the details of the vaccine, we want to be able to kind of get in, and I'm starting to get towards the end, but this is the juicy part where everybody wants to kind of know, what do I do? Okay. So this is a breakdown of the different vaccines that exist. And I'm going to go through them at first. So what I will do first is start with the Pfizer and the Moderna. Okay. And the reason why I'm going to start with those two is very important. But before I start there, I'm going to come back to the slide. I want to show you one image. Okay. Give me a second. So basically this slide, okay, DNA is what makes us. Your hair you grow, the skin, your teeth, that's DNA. But as you know, how you keep reproducing these cells is you have something called messenger RNA. So basically if you say, hey, I want to reproduce, you know, another tooth, okay, this is the code for the tooth, right? It's half of it. It's like a mirror image. So now when you kind of go to the cell says, oh, okay, I'm reading this code here. I'm gonna make this protein. So you send me this. It's kind of like, it's a bad example, but you know, lemonade boulette, you know, when they give you the piece of paper, you go, you say what numbers you want to play, and you replicate those numbers and you play for the lotto. So it's similar to that, right? And the idea is that the messenger RNA is what helps you to kind of get to you know, to make a protein, okay? In this case, you're using messenger RNA to make an antibody, right? And so this is basically what the virus actually looks like. So on top of the virus, it kind of gets encoded. Yes, this kind of looks like Cheetos, but it's not Cheetos, I promise you. Don't go out and try to kiss or taste anybody, and you know, it may not work out in your favor. But the idea is the spike protein is essentially say, hey, if this is my hand, you know, you cannot get into my hand unless we have a handshake. The spike protein is the hand that does the handshake. So if I come in contact with a cell, the cell says, okay, who are you? Let me feel who you are. And then it touches the spike protein, and then the spike protein gets into the cell, takes over the cell, and it basically causes this entire thing that we kind of talked about. And so what we're trying to do is allow you to be able to build the antibodies, right, without necessarily getting exposed to the actual virus, right? And so what they've done, which this technology, which is called, you know, the CRISPR technology, is actually used in cancer research, okay? This was not something that just came out of a lab because of this. This was not something that just sprung up. This is research that's been going on for the last 20 to 30 years, because there's so many different types of cancer. So the idea is that how do I get Guy to fight a cancer? How do I get patient A to fight the cancer? Use your own machinery. You have such a beautiful, amazing mechanism, put it to work. And that is the reason why the messenger RNA, existed, right? So what they're actually doing is to be able to kind of take the messenger RNA of the spike protein without the virus. So we're not talking about a live virus at all. So you can't get an actual infection from the COVID vaccine, okay? Not a live virus. Some vaccines like polio and certain things, yes, those are live vaccines. Different conversation. But currently with COVID, there's no live virus being injected into anybody, okay? So it's a messenger RNA that's essentially being able to kind of, to the spike protein. So this messenger RNA is what's in the vaccine. You inject the person with this messenger RNA, and then when it comes into contact with your immune cells, it says, hey, I recognize this messenger RNA. I take you into the cell that makes the protein, and basically what you do is now you start making antibodies to the spike protein. So now let's say, for example, if you do get exposed to the actual virus, you have the antibodies to the spike protein because you basically cut out the middleman, which is the actual virus, which is amazing breakthrough in technology and ingenuity. And just to understand, there is a Nigerian sister that was very profound and instrumental in the breakthrough of this vaccine. Again, not victims, okay? Again, not victims. Let's just get that right. So it's one of those things where, using the messenger RNA helps you to be able to kind of get the spike protein, allows us to be able to kind of do that. So that's amazing. And so going back to this, so when I refer to this, the Pfizer and the Moderna, those are the first two vaccines that came out. And it's basically an RNA virus, okay? As I mentioned, it uses the RNA, right, to teach the immune system to target the virus's surface, which is that spike protein that we talked about. And basically for this, when we talk about the effectiveness, when you hear that 95% and a 94.5%, I'll show you the slide, okay? I'm gonna stay on the slide and jump in between other images to kind of help to explain it. So basically, this is the actual study that was done with patients, okay? If you look at day 0 here in this corner, the blue is people there was two groups. When you run a study, you run it in different ways. People that don't get the actual vaccine and people that actually get the vaccine. And so if you look, the blue and the red at day 0, people that are in the group going about the casual business, you see the rate of infection was essentially the same in both groups. Look what happened, right? As they gave more vaccine to the group, the people with the actual vaccine, as they were going about their daily lives, that number essentially flattened. You see that red? That kind of stayed down in the bottom here. Look what happened to the blue line. These were people in the group that did not get the actual vaccine, right? They got the placebo. And so these people were contracting the coronavirus at a much faster rate, right? And having a lot more symptoms, right? And so basically, when you talk about 94, 95% effectiveness, that's basically the endpoint for this study is what that effectiveness is talking about. Now, however, when you're talking about the Johnson & Johnson, right? This one is slightly different. This one is what you refer to as a viral vector, okay? So what it is it's not a live COVID virus, okay? What it is, it's basically a protein, right? Like similar to what the virus is, but it's not a live functional point, deprived of any functionality. If you kind of think about it as like a unit, right? You have this person, but they're not able to reproduce or cause any kind of function, okay? And so the idea then again is through the same mechanism to be able to kind of teach the immune system to attack the protein virus, right? That's used to kind of cause the infection, right? So, so this is basically a non-dangerous virus, right? So because as we kind of talked about, viruses are very genius. Of all the things that kind of survive on Earth, through different things, viruses and fungus is based because they adapt so well, right? Because like I said, They don't do their own job. They just go into your job and basically have you do all the work for them, right? So basically, this is us now trying to utilize the genius of a virus to kind of help make it do something that's positive. And so when they talk about the effectiveness being 66 to 72%, is because this is actually looking at something very different. Whereas Johnson & Johnson and Pfizer was looking at, rate of infection. This is basically looking, how is it preventing death? You understand? So it's the effectiveness is very different. So it's almost as if the percentages, yes, it seem different, but we're asking two different questions. So if I said, hey, how do I, if I look to say by meditation or prayer, how do I prevent you from getting mad? Okay, yes, it's 95% effective, right? Versus say, hey, how does prayer help you stop him from punching somebody in the face? That may be 60%. So it's two different questions, but the same thing deals with COVID, but the response is very different. So from that standpoint, it helps it to kind of understand. And the other thing about the Johnson & Johnson, this was actually, the study was actually done in South Africa and in England, where there was this COVID variant that was in the community. And just to kind of get that part straight about the COVID variant, yes, it's a different adaptation. And if I go back to the spike protein, the way the vaccine is designed, it helps to recognize so many different parts of the virus. So if the right hand has mutated, it'll pick up the left hand, the ear, the head, the leg. So it's going to be able to kind of take care of that virus in a different way, right? So it still is able to kind of protect you, right? But remember, sensationalism sell newspapers, sell ads. So I hate when people just throw the facts out and they don't give you context, right? Similar to the AstraZeneca vaccine, when they say, well, there was a higher rate of blood clots in those patients and therefore the vaccine is not effective. Remember, people were dying at home. When people come into the emergency room and into the hospital, we're putting them prophylactically ahead of time without even knowing that they have clot on high dose blood thinners because we know they're going to form clot anyway. So the virus is a pro-inflammatory state, which makes you form clots, right? So if you happen to have COVID and you got the stuff and you got so it's one of those things where you want to keep that in mind, okay? And so going back to the slide where we're talking about the storage is one of those things where, people kind of think about it. The difference between the Pfizer and Moderna is essentially how well can it be refrigerated. The Pfizer, very short half-life in there, so therefore as soon as you kind of get it, you want to be able to administer it. Whereas the Moderna can be kept in the fridge for about a month. But at the same time, the Johnson & Johnson is designed where it's able to kind of last much longer than any other of the vaccines. And so from that standpoint, is being able to kind of, last longer. So if you're talking about in developing countries where they may not have the resources, this may be something that's of value, right? And, in contrast to the other two, it's a one-shot vaccine versus the other two, it's a two-shot vaccine. This is what I tell people. If you have access to get a vaccine, take it. Don't say, I'm not going to take this one because I'm going to wait for this one. Because while you're waiting, God forbid, you may get exposed to COVID and get sick. And that vaccine may not do you any good at that point, right? So you want to be able to kind of do it. And so far, the data is very reassuring in terms of the rate of transmission. Now, why is it important to kind of talk about rate of transmission for the vaccine? When you get exposed to COVID, right, it does the inflammation, the organ damage that we kind of talk about, right? But then what also happens is that, it kind of, you may still be shedding virus protein. But what happens is that it's noted that the rate of transmission of you being able to cause actual infection is significantly lower. That's why they're saying for vaccinated people, they're able to kind of get in, be around other people, so on and so forth, right? And so that's why you're going to see they'll start opening it to different groups, okay? And so if you can kind of think about the idea of the messenger RNA, think about it as like the Trojan horse, right? You want to get into Troy, you stuff some people inside the wooden horse, and you give them the horse as a gift, let them soak it up, and then the antibodies come out to kind of do their thing. And so in a sense, that's essentially what the core data is around that point. And so for the Pfizer and Moderna, it is advised if you have previous COVID infection, you want to wait about 90 days. And obviously you may still have antibodies, but as of right now, no one really knows how well, if you've been sick in the past, how long your actual native antibodies last for, right? So that's something we don't know. So the moment you're eligible, even if you've had COVID before, you can go ahead and take the vaccine, and I advise that you're able to kind of take it. And that is something that people say, hey, I tested positive for COVID, 3 weeks ago, they tested me again, I got sick again. Let's just break that down a little bit. The first thing is sometimes you're able to kind of shed virus for a long time. Some people, they test them, keep testing them, and they're still shedding not actual infection, but the protein. Remember, the swab doesn't check for symptom, right? It just basically checks residual protein and it's swabbing to see if it reacts. So some people shed like actual dead COVID protein that can give you a positive test up until like 8, sometimes 10 weeks, right? So that's one aspect. The other thing is, remember, you have the 3 phases, right? The virus, where you get the fever, the viral-like symptoms, and then you get the lung process, right? The lung damage. So if you're still feeling short of breath, right? 4 or 5 weeks later, after you've gotten the infectious part of COVID, you may just now have interstitial lung disease, which is damage of the lung 4, 5, 6 weeks later. It's not necessarily like a continuing COVID infection. It's just you're just not recovering because your lung may actually be damaged. And so that is why you want to seek help. You want to know rather than not know, because if you're able to kind of get support early, you may actually help to minimize, the impact of that. And so just because I know people kind of talk about that aspect of it, let's talk about the potential side effects, okay? Yes, there's a reaction at the site. And if somebody has known allergies before anaphylaxis reaction, these are people that we admit to the hospital to give them the vaccine and to watch them. Even myself, after I took the vaccine, they made sure they watched me for an hour before I left the clinic, and I don't have any prior history. And so if you look at your risk of getting COVID, right, and potentially not making it versus the benefit of the vaccine with the rare less than 0.5% chance of anaphylaxis, right? Like if you were a betting person, bet on what you know, right? Because you can win and abstain and hold on for as many time as you want, but it may not necessarily give you that full impact that you want. Remember, just like you would find information about anything else, don't act as if you can't get that information. If you can, call someone, reach out to me. I can refer you to different people. If you don't trust me, I'll have you talk to somebody else that you feel more trusted with. And when people talk to you about COVID, and don't ask them, what is the point that they don't trust, and refer them to an area where they do trust, right? But allow them to get that information from somewhere, but trusted information, right? And if they don't agree with you, it's okay. Focus on the people you're able to kind of help and come back to them, but just don't throw them away because, they're COVID denied, etc. I saw a sign recently, okay, where somebody actually paid for this to put on this side of their business. This is an actual person, okay? It says COVID equals power grab equals communism. And this is who we're dealing with, okay? This is something they paid for, okay? COVID, they could have taken that money and given it to science and research. COVID equals power grab equals communism, okay? So just to kind of let you know, focus on the things that you can focus on. And so we've talked about the storage of the vaccine. And so when we kind of talk about there's different vaccines, I'll just only tell you the ones that are currently here in the United States. Is basically, we're talking about Pfizer, right? Which kind of did a combined work with a German company to create their vaccine. The Moderna we talked about. And then the Johnson & Johnson we talked about. The AstraZeneca is basically a UK-based vaccine. It's not available here. So for all intent purposes, is the 3 vaccines that I kind of mentioned to you. And during that point, we can kind of do that. And so right now, these are the points that we need to be able to kind of keep in mind. And so this slide just kind of, again, reaffirms the rate of efficacy. But remember, with the Johnson & Johnson versus the Pfizer and Moderna, when they designed the study, right, they were asking a different question. And so, preventing COVID infection is a lot easier to do, right, versus somebody who in a Johnson & Johnson who was actually sick, got the vaccine, and you actually were able to prevent death, right? So it's two different questions. So just because the efficacy seems like it's a full 30 points doesn't mean that Johnson & Johnson is not effective, okay? So that's basically the reason why I bring that. And so at this point, I will, my portion is done. I'll pass it on to Guylaine, who's a PA, and Amanda will do an introduction at Cornell, what she's been doing with COVID, hands-on and also in the front line, to kind of share what community resources and municipal resources for you guys to be able to empower yourself. Go ahead, Guylaine.
All right. We do thank you, Dr. Guy Aristide, for your information. Really, the key takeaway I took from this was how, we are at the forefront of, medical ingenuity for years, even centuries, and also how you explain the microscopic transmission of the virus. So we definitely appreciate all the information that you have shared with us. I do want to remind the participants on the call that we are opening the chat for any questions that you may have during the presentation. And you can also ask any questions, and I also posted Dr. Guy's information on the chat. Just if you would like to write it down at the moment, his email is garistide15@gmail.com. Okay, that's garistide15@gmail.com. And you can contact them at the number of 917-682-5301. Okay, I do want to remind everyone again, if you have any questions, to please write it down in the chat, and we will have a Q&A segment right after the second presentation. So on to that, I will be stopping the screen share. Second. Dr. Guy, are you able to stop the screen share? Because I'm not able to.
Give me a second. So I apologize.
Oh, no problem.
Yes, I'll revert it back.
Okay, awesome. Okay, great. Thank you. All right. So on to our second speaker. As Dr. Guy mentioned, is Guylaine. She's a PA at Presbyterian Weill Cornell Hospital. She has been there for 6 years. She started her education in medicine and health care with a Bachelor's of Science degree at LIU in 1994. She followed that with a master's degree at Stony Brook, where she was accepted into the program of Advanced Physician Studies and Healthcare Management. Her experience spans 26 years in medicine and intensive care. That 26 years have covered, she has worked in Maimonides Medical Center, Methodist Hospital, and also SUNY Downstate. And as I mentioned now, she's at the Presbyterian Weill Cornell Hospital. All that is good. But one thing that I'm very, very proud to mention about our sister, Guylaine Aristide, is that she's a very strong community member where, I would say probably, 80% of the people on this call have either spoken to her or will recognize her or are familiar with her. So she has done many humanitarian effort. She's at the head of the humanitarian effort in Garaka, who is sponsoring this presentation. And really, we are here under her leadership. She has put all this together, all the information together to make sure that us in the community, we would have the access to it. So when we do make a decision about getting the vaccine or maybe taking precautious measures towards, preventing contracting the virus, she has gathered all that and has presented it to us. So it's my pleasure. Really, it's an honor for me to introduce the very special, very kind-hearted and open-hearted PA, Ghislaine Aristide. Gigi, you can go ahead. I'm not sure if you're able to share.
Just come off mute, Ghislaine.
We can't hear you. No, we can't hear you.
Ghislaine, come off mute.
She's unmuted, but it's the mic.
Okay. We still can't hear.
Okay.
We apologize for that. Just 1 second. I'm gonna get in contact with her.
How is it now, guys?
Good.
Yeah? Perfect, perfect. Hello, everyone. I want to personally say thank you to my keynote speaker, Guy Aristide, for doing such a wonderful job. And I want everybody to give him a round of applause because he's really, I have so much admiration for this guy because he's such a philanthropist. He really thinks about everyone else but himself most of the time. And Guy, we want to say thank you on behalf of Radaka and the whole community for taking the time out and do this with such passion and love. So we could see that, you know, what you presented is something that you really truly believe and it comes from your heart. So we want to say thank you and don't go away yet. We're going to have some questions for you. On another note, the guy basically took everything that I had to speak about. There's nothing for me to talk about. You understand? And which is good. So I'll be using a few minutes of your time just to basically give you some pointers, just to kind of second much of what Guy already mentioned to you. First thing I will go into is that I know we learn in like broad language, social distance isolation. So my segment will be first and foremost focus on a little bit of transmission. I know Dr. Aristide mentioned a lot about transmission, but essentially to put it in like mild and lay term, transmission, guys, it's really, I'm talking, I could be seeing, and sometimes I can even breathe. And as I'm doing that, I'm transmitting, I'm sending droplets in the air, and that other person next to me literally can like breathe that air and become sick if I have COVID. Essentially, that's how the transmission is that easy. Because most time people will say, oh, it's just like the flu. No, it's not like the flu. Because with the flu, okay, the effectiveness of the flu to be transmitted from from person to person is about 40 to 60%. COVID has such a higher percentage rate of transmission than that. Okay, so that means it's something serious that we're dealing with. They place COVID right in the middle of the flu and the measles. Okay, that means measles is highly, highly, highly contagious and transmissible, but COVID is right in the middle. So that means, that being said, it's very, contagious. And that being said, we have to really practice the means that are in place right now. Okay, so we're talking about what we had even before vaccine came along. Okay, we're talking about wearing the mask. We cannot emphasize that much more than wearing the mask because the mask helped. The mask is what saved us when we had no idea what was going on. Okay, so just by mainly wearing masks, even providers, we had no idea what we were doing. We're just trying different things. But having the mask on really saves a lot of lives. So even now, vaccine, whatever's out there, we cannot emphasize more how much we have to wear the mask, okay? Social distances. That means the days of being like right in people's face are no longer for a while. That means that 6 feet has to be maintained at all time, okay? Unless it's somebody that you live with or you've been in contact with, you pretty much know they are in and out. You cannot be less than like 6 feet, you know, away from that person, okay? Washing hands, simple as that, wash hands. If you go on YouTube, if you Google wash hands, they'll show you how to properly wash your hands for that 20 seconds. We cannot emphasize that enough. I'll add my own little thing, you know, which the CDC probably has it there too, but clean your most used contact, okay? Find a good EPA approved disinfectant, your Lysol, your Clorox, whatever. Find a good one. If you want to go again, you can Google, because everything is at our fingertips. Like Guy said, sometimes you think we have to be such a big thing to find information. Everything is right there at our fingertips. Google how to wash your hands. Google what are the EPA disinfectant that are approved by the FDA to use for like this COVID business. All your clothes, all your surfaces that are usually, you know, utilized during the day, you need to really disinfect them. Okay, you're talking about your doorknobs, your light switch, your table, anything that you use and other people use at home every day. Once a day, you guys should really be cleaning that contact surface. Okay, that being said, all this prevention are there and they added now be vaccinated. Okay, and this is where we start our little conversation. And I'm glad Dr. Aristide kind of really talked about everything really about the differences with the vaccine. But what I'll say with that, when they added the vaccine, like he said, essentially is pretty much whatever is available to us. We have the Pfizer, we have the Moderna, and we have the Johnson & Johnson. With the Pfizer and Moderna, you mentioned the percent, I don't have to go into detail, okay? But just know that when they say you get your first, you go for your second, just try to keep within that window period that they allow you guys to keep, right? For the Pfizer, I think it's 2 weeks, 21 days. You have like a plus minus 4 days for the grace period. And for the Moderna, you have 28 days until. At the most extreme case, let's say something happened, you know, you have to be out of the country or something, you can extend it up to 6 weeks, but it's not really recommended, okay? You have that window at least to say, I can still take it even if I fell, you know, off schedule a little. So any vaccine that's available, okay? And then people are saying different things, oh, you know, vaccine is not approved, okay? The FDA gave us an emergency authorization approval, okay? The cases where they do that is when they recognize that there's an absolute emergency, a state of emergency. And with this pandemic of coronavirus, that's exactly what we have, a state of emergency, okay? And even if it's a state of emergency, for the FDA to say, yes, go ahead, it has to be like there's no other alternatives available, and there are none. And it has to be where the benefit of this product is more, it outweighs the risk, okay? And in this case, with all of the 3 vaccines we have available, like Dr. Aristide mentioned, it's like all the benefit outweigh the risk. And I'm so happy that Dr. Aristide covered the base where people think this thing is going straight into your DNA, okay? Thankfully, the vaccines we have that were emergently authorized by the FDA do not go into your DNA. It does not give you the virus. And I cannot stress that enough. And even me as a medical person, I must admit how much garbage I was telling people, you know, up until the time when we were doing the research for this. So that means, that being said, guys, we have to be educated. At the end of the day, it's still your choice to say, I want to, or I don't want to, but we cannot, okay, especially as a race, we cannot really say on the corner and say, oh, you know, repeating what, you know, conspiracies and all these other people are saying. Okay, we have to be educated, and then at the end of the day, make a decision for or against. Okay, so I'm so happy that Dr. Aristide talked about a little bit about the composition and mechanism of action of those viruses, because none of them that are available actually alter your DNA or give you the virus. Okay, the AstraZeneca for that maybe particular reason is not really administered here or authorized to use here, because the AstraZeneca, the mechanism of action is a little bit different, okay? That's the one that kind of play with your DNA. But here, those three that FDA approved on our side has nothing to do with the, DNA mechanism. So that being said. Also, second thing I want to say about the vaccine is that if you go someplace and they tell you have to be, they have to charge you, you don't have to be charged for the vaccine. The vaccine is actually absolutely free of charge. It costs the government about $20 for the Pfizer, about $24 to $37 for the Moderna, and $10 for the Johnson & Johnson. So that means those vaccines, when you go, to get your vaccine, you don't have to pay 1 cent. Even if you have coverage, even if you don't have coverage, you can get the vaccine. Even if you're a resident or you're an illegal immigrant, you can get the vaccine, okay? No matter what your status is, you are not responsible for any fee. Sometimes you may go to a private doctor and he may charge you for an administration fee, okay? The administration fee, that's something like with the insurance company, they can like work with that just because they use the staff to administer. But the vaccine itself, you don't have to pay anything for the vaccine at all, okay? So that is what we're gonna say about the vaccine. The other thing I wanted to say about the vaccine, right now the vaccine is available and they're focusing on like the most high risk population, okay? So that being said, for us, healthcare worker, we had a first dip. Healthcare worker, frontline worker, anything like those people that Dr. Aristide mentioned who deliver us our food, pick up our garbage, anything that are most at risk, they qualify for the vaccine first. And you could see why. You could see why. Because when everybody was in hiding, when everybody was like quarantining, us frontline worker and healthcare worker, we had to be going toward the disease. And that's why they figure we should be the first one to kind of qualify to get the vaccine, because by us being safe, everybody else can be safe, okay? And I'm not kidding you when I say there are some institutions where patient would come in, with no COVID and come out with COVID. And that being said, is because you have a lot of healthcare worker, people sometimes, I don't want to say irresponsible because they still have, that are coming in. If you feel a little sick, stay home, don't come. If you have a little fever, don't come. But you have people who knowingly would be sick and go in contact with people and causes, people to get sick. So that's why, as a rule of thumb, they recommend that every healthcare worker, frontline worker, everybody will come in contact with people that they do get the first dib at the vaccine. So that, again, is really very good because, believe it or not, close to 500,000 healthcare workers were infected with COVID-19. And out of that, we have a good 1,500 plus people who die, healthcare workers who died from the COVID-19. So it's not a joke for us. That's why sometimes we're very passionate, because when people say COVID is a gimmick, when people say COVID is a make believe, we kind of take that very personal, because we the one, when everyone was in hiding, who were going to the ICUs and dealing with those people and watching those people dying, lonely, scared. They had nobody, because we don't even allow visitors to come in. And sometimes those people, we are the last one that they see before they take their last breath. So for us, this is very personal and passionate. And that's why, and you guys attending the session tonight, if there's one take-home message, is that you have to be the light and the voice out there. You may not choose to do what we recommend or whatever, but you have to be the voice to say, based on everything that you've seen. And this is just a little glimpse that we give you, okay? When they were packing bodies, in U-Haul trucks, when they were packing bodies in like frozen truck, outside the hospital, we saw it all. It's not something that people come and tell us. So that's why when they say it's not whatever, no, it's not a game. It's not a game. And we have to really be the one who educate people and take it more seriously. You don't have to educate them, in the hope of them being vaccinated, but you have to educate them in the hope of being safe and protect their loved ones. Because sometimes you have the young and vital ones who don't show no signs, no symptoms, and then they go and contaminate your little old ladies and stuff. So that's why it's very important that you guys become the voice and speak to them about, safety and to practice those preventive measures. The other thing, besides the frontline worker, the healthcare worker, the second category of people is everyone 60 years of age and over. 60 years of age and over, okay? Because we could see why, okay? As you become older, you become more vulnerable, your immune system is down, so you qualify to really get the vaccine because you're more at risk. And as we can see, even though they say that it's really the elderly and the comorbidities, but occasionally you'll get a young person also that comes in. You cannot have any rationale why this person end up in those stages that Dr. Aristide discussed, but they do happen to those people. Because a lot of time we're walking around and we don't know really what's happening with our body. Just because we've never been admitted to a hospital or we've ever had a diagnosis, we may have something brewing in our body that we don't know. That's why as such, we have to be careful. So 60 and plus is the second category. The third category now is anybody 18 years of age and over with a comorbidity. That means anybody 18 years old and up with anything that makes them more susceptible to any of the COVID, damages is entitled to get the vaccine. So spread the news. Really, it's important that everybody know what's available out there for them. What I will say again is, okay, like Dr. Aristide mentioned, when should I take it? Whenever it's available to you. Sometimes we put it off and then they kind of move and then you have to go further away. It's like a whole thing. So if somebody is interested in getting the vaccine, we have a website where you guys can go directly and look for the information. Okay, it's vaccinefinder.org. Vaccinefinder.org. And I guess our moderator can put it in the chat as well. You could also contact your state and local officials to find out. You could contact your local pharmacy, any of the pharmacy, Walgreens, CVS, any one of them. They'll even go by your zip code, but there's no reason not to get the information because it's all there, and the vaccine is available to most of the people in the communities. So just do what we have to do. The next thing I want to touch base on is, and of course we welcome the questions, okay? The next thing I want to let you guys know is that we hear about oh my God, it's side effect, people are dying. Whenever we see one person who had an adverse reaction, we're like, they're dying. Or we had a very bad reaction, which we call anaphylactic reaction. Oh my God, it's so bad. I want you guys to know that with all the millions of people who took the vaccine, based on the reporting website of people who actually got a reaction, it's very, very, very minimal. Okay, so I would say something around maybe like 2,000 plus of people who really had a reaction or die. And even the death, based on the autopsy and review, they could not even identify whether or not it was directly related to the COVID. Because they do have site where after you get the vaccination, you can go and say, I'm feeling feverish, my arm hurts, my chest hurt, or I'm nauseous, like any of the reporting, any of the symptoms that's associated with the vaccination could actually be reported, and unfortunately it all depends. Some people may be like, oh, I have a little soreness and that's okay, I take some Tylenol. Some people may, oh, I have to report this, it's something serious. So I want you to know that they have actual website and phone numbers where you can directly report symptoms after you get vaccinated. Once you get vaccinated, for most of us who have the smartphone, they have this app called vSafe. vSafe, you just download and basically you report any symptoms that you may have or may be experiencing after the vaccination. And what's beautiful about it is that once you get vaccinated, they don't let you go. Like Dr. Aristide said, he was lucky. I guess they figure his life was so much more valuable. They kept him for an hour because they only kept some other people for 30 minutes. I guess. So, but they keep you in the vicinity for a good 30 minutes at most to make sure that you're not displaying any of the symptoms of nausea, soreness, or anything, or passing out, or shortness of breath, or none of that. And after that 30 minutes, they let you go. And of course, you have access to the V-Safe on your app, on your phone, to actually just like continue the follow-up. And I'll tell you why the V-Safe is important, right? You may say, why, click on the V-Safe and tell them if I'm feeling a little soreness. Sometimes it's important because guess what? Those 3 vaccines that were approved here in the US were on an emergency basis. And it's gonna really be up to us, and our continuous reporting. That's gonna determine how safe, how much we're gonna need. Are we gonna need to have a booster? So we basically will be like the ongoing clinical, people, okay? We know that the FDA approved it because there was no immediate, no damaging effect right on the spot. But in terms of how long it stays in our system, we're gonna have to be the one dictating in the future, who will be getting it and how often and so forth. So it's important that you guys do the V-Safe if you plan on being vaccinated. In terms of reporting adverse effect, the CDC have this site also where you can actually call and report more serious effect, okay? The site is VAERS, okay, Mano? I don't know if you're typing it for them. It's VAERS, and the actual site is VAERS.HHS.gov, okay? And then when you want to report something serious, you go on that website and you basically tell them this is what I'm experiencing, and they'll keep a tab and they'll take it from there, okay? But those are basically the 2 reporting system. And of course, feel free to report to any of your local, like if you have a primary care, they can guide you to it. And like Guy said, you could really like look up, Google, whatever information, you could really look to see where do you go, whatever. And when all else fail, 911. Okay, on the spot. I would not delay care by just trying to find where to report a symptom. Okay, call 911 if in doubt. But I'll tell you, I work at Well Cornell, and we are responsible for the whole network is Cornell, Columbia, and we have some other hospital that we acquired, such as Methodist Hospital. We have the Lower Manhattan Hospital, which used to be Beekman. That's now part of NYP system, New York Presbyterian system. We have Lower Manhattan, New York Methodist, we have Queens Hospital, we have Cornell, where I am, we have Columbia, we have Allen, we have Lawrence, we have Upstate, and out of all the hospital, okay, the percentage rate of vaccination is like 94+%. And out of all of us who are vaccinated, the amount of people reporting side effect is like very little, besides soreness and feeling, so I really encourage you guys to think about it and see, moving toward the future, because again, which bring me to a point of herd immunity. Guy, maybe you'll touch up on that, the herd immunity in a little bit. And then before I'll give the guy the floor to kind of finish with the herd immunity, one more thing is that people are concerned about the variants, because as we hear in the news, we have variants of the COVID-19 coming up in the UK, Brazil, and South Africa, and also some parts of New York, okay? And I want you guys to know too that based on research that the vaccination available, which is the Johnson & Johnson, the Pfizer, and the Moderna, are really effective enough to cover the variants, okay? There's more ongoing clinical study, but it's enough to cover the variants. And the variants, again, is a result of pretty much not knowing what we're doing, not being on top of the virus, and this thing are replicating and duplicating, and in a sense that we may be losing grasp on it, but with the vaccine, they find that it covers effectively enough. So that's another way to encourage, okay? So, that's it, I think, Guy, because you covered pretty much everything. So I'll let you speak to them about herd immunity, and we'll be opening the floor for questions that you guys may have.
So great job, Gigi. That was very, because sometimes, you can get abstract information, the knowledge, but the implementation, to be able to kind of get it and the follow-up step is there. So in terms of the herd immunity, if you can kind of think about it, is if there's somebody about to attack something, right? Trying to attack like a group versus attacking one person, right? So the idea is that it's much harder to attack a group if every individual person is armed. Then the whole group becomes safer. And so what that means is that if there's a herd of like a group of 100 people and 90% of people is armed with a weapon, right? You're less likely to kind of attack that group. And so what ends up happening is that even if you see it in the wild when a tiger is hunting down, right? They're trying to go for the weakest and the most vulnerable, right? And so when the herd immunity is when somebody was talking before about herd immunity before the vaccine, that was by far the most dangerous thing that they could have said, right? Initially, when they talk about, get enough people sick, that enough people exposed to the virus, that you will get herd immunity. Yes, you can get herd immunity, but the process is at that the number of fatalities that you would have had to absorb to get that herd immunity would have been astronomical. We're talking about millions of people dying for the whole country to get herd immunity. And that guy was a radiologist, okay? Like, it's important to kind of understand the source of information. He was not an infectious disease person. He was not a pulmonologist. He was not a critical care person. He was not a scientist, okay? So that was very dangerous. Now, in terms of the vaccine, in terms of that, now you're talking about herd immunity as more people are vaccinated, mixed in with people that previously got exposed and were safe and is doing better now. It makes it different. Let's just say in that same group, if the attacker is the virus and I am armed with my vaccine and my antibodies, it comes into me, the virus dies right there, right? Versus the virus coming into me, jumping into the next person, jumping into the next person. So, and that's what they refer to as a vector. So as you're vaccinated and the herd immunity gets better, then the vector sources for transmission goes down lower. And somebody, I think Claudia had mentioned a point about, the Fauci initially mentioned after the vaccine to wear your mask. And then now the CDC is recommending that you don't need to wear your mask around other people that's vaccinated. It goes herd immunity, right? So you're talking about science versus public health policy. So the public health policy is, hey, at that point, we don't have enough people, right, protected, right, to have people start taking their masks off willy-nilly just running around, right? And so it was a very difficult message to kind of do, one systematic thing, right? Versus now, as more and more people, I think now we've passed, over 30 million people vaccinated as of last week. Now you're talking about there's less likely of transmission through 30 million people. And as time keeps growing, you go to 60 million, 100 million, then that becomes a lot more effective to prevent spread through community. Because remember, in the spring, the big problem is spread within the community. That's when you kind of tell if things are going well, if things are gonna bounce back, is the spread through the community. And so that's basically where the concept of herd immunity stems from. And one thing that somebody mentioned, Father Rigord mentioned, is why come Haiti people, they were in carnival and there was not much of COVID. There's not much mortality. So that's what, for lack of a better word, and I think Dr. Yvette is on the line. She's a powerhouse in her own right, and I consider her, but she can speak to that a lot better. But the idea of that is in Haiti, one, you're not routinely screening and testing, right? So if somebody has COVID, you would not know. One is it's a more tropical and more odd. And when people die, how are you acknowledging who dies of COVID, who doesn't die of COVID? So the actual numbers may not be, you may not know the actual numbers. So I would presume that in any given place, that COVID take the same precaution that you would in Canada, the US, and every other place. And so that's tremendous to kind of know. But I think at some point we'll get to herd immunity. So I know, some of you on the call, because you're trying to answer question about the vaccine and everything else, it's important that you feel, but if you don't feel comfortable, don't just remain stagnant in that feeling. Allow yourself, get the information. And so at some point, even if you're not vaccinated, for those of us who do go on to get vaccinated, we are providing that herd immunity. And so at some point, we will be charging you $500 for every day you don't take the vaccine, that you're getting that free protection. So that's just a little joke. But the idea is to kind of like, we're all in this, right? Life is a bell curve, right? All our experiences are different. But what I try to think of is think about the people who are not here to have this intellectual argument about and Johnson & Johnson, right? I had the pleasure of speaking with one of the clerks, very pleasant lady in her mid-50s. She was the clerk in the ICU. She got sick. She was symptomatic for 5 days, went home. Her husband got sick. Her husband got sick and died, right? So think about the guilt. She was the one that contracted the COVID virus, brought it home, and her husband, right? And yesterday was a 1-year anniversary when he passed. And from the way she described it, he died from a pulmonary embolism because he got better and he went out to pay his car note and he just collapsed, right? And there was no vaccine being given at that point, right? So keep in mind that because this thing is so virulent, it's so tenacious, that if you recover, consider yourself more fortunate and lucky than like, my immune system's that great. Because even then, genetically, you can have two people who's in fairly good health and one progress and develop a lot of complications. You may not know why. So at this point, that's all that I could share. Like, I'm available to kind of answer questions as much as possible. So whatever questions may have been raised during this talk, Emmanuel, if you let us know what they are, and I can try to answer them as best as possible.
And we also, sorry, Mano, we also are very lucky to have Dr. Yvette Edouard. She's a practitioner in Haiti, to have her with us online. So any questions, she'll be able to kind of help. We're so happy that you could join us. Elle parle français également. Fait que si vous êtes plus confortable en français, vous pouvez demander en français également.
Yeah, and I'll say this, I've had knowing Dr. Edouard and Yvette, I rely on her. I mean, she knows all things Haiti, and she's a powerhouse. I can't say it in any other way. She is such an inspiration. Just the things she's able to do with what she has is I really admire her. I gotta say that.
Very good. And we salute all our nurses. We salute all our nurses in the audience. We have Jeanette, we have my auntie, Yvose, and everyone else. Oh my God, we have respiratory therapists. We have every angle. So feel free, people, like if you want to add something that we may not have that angle, feel free to join, okay? And add your feedback. Thank you.
And Emmanuel, any questions specific to the talk? I know I've answered two of the questions about why Dr. Fauci wanted, the mask versus not the mask. I think it was just a matter of making sure enough people were vaccinated to make a public statement that way. So it's just a matter of making sure enough people were protected that it, if you have a group of home, was vaccinated to kind of minimize transition. So one thing I used to joke around is to say during the pandemic before the vaccine, if we didn't quarantine together, we can't hang together, right? So it's kind of like saying like, if I know you're safe, then I can take off my mask and have a conversation. But if you leave my house and I know you're more likely to be sloppy and be all mixy, you don't want to take that risk.
Okay, all right, good. Thank you, Dr. Aristide and PA Aristide for your presentation. And as you said, the question that was asked, Dr. Aristide, was from Claudia Sam about the Dr. Fauci question. We had plenty of more questions that came in while you guys were speaking, and I'll be going over them, accordingly as they came in. So the first question was from Gina, okay, and she asked, why do they ask you to bring your insurance card if the vaccine is free?
I think if primary care doctor, like a doctor's office, asks for your insurance card. But if you go to any of the vaccination centers, that would not be the case. It may just be that doctor, for the hour or half hour that they're using the staff to administer the vaccine, they just probably will bill the insurance to cover that time that they're taking out. But let's just say if the city or the state is pulling, already staff to just give the vaccine, that administrative cost is already allocated for. So for that reason, so if you're concerned about that, just go to a vaccination center rather to a doctor's office, and that will be done right away, and basically it's going to the insurance company. And if they're asking you to pay a copay, you just tell them you don't feel comfortable. And if they feel like they're giving you pressure where they're giving option of copay versus vaccine, go to a vaccination center and then just report them if you feel uncomfortable, because they should make it a low barrier of entry for you versus putting different obstacles for you to feel like reluctant to take it.
Okay, great. Thank you, Dr. Aristide, and thank you, Gina, for your question. I do want to point out as well that so we're going over the questions that were asked on the chat. We'll also be opening the floor for people who like to verbally ask questions or verbally bring up their concerns. So after I'm done with that, we'll open the floor for the verbal questions. So this question, I guess, is for both of you guys, and that was asked from Ketsia Mokum. And her question was, if one develops a cold between vaccinations, should you still take the second dose, or should you be clear of the cold first?
So I'll answer it in this way. The first part is, if you've had COVID for Pfizer, Moderna, they're recommending that it approximately 90 days from when you get the vaccine. Johnson & Johnson is about a month, which is a difference. And so in terms of a common cold, first step is, I would say, go get tested. Because what you want to make sure is you didn't contract the COVID infection just being in the community. You just have to remember, life is messy, right? Life is not like this square box where everything goes according to plan, right? There's going to be variations of people that take, and before they actually build the immunity to be able to protect them, to get the efficacy of the second dose, they might have gotten exposed. But remember, you're not getting a live virus. And so the likelihood of people confusing getting a COVID infection from the vaccine is unlikely, okay? And so from that standpoint, that's just there, so that's something to kind of keep in mind. And so, yes, if you do have a cold, you can communicate with your healthcare provider, with the vaccination center, and tell them, hey, I still got a runny nose, still got ache. I did take my COVID test. It was negative. I can delay my second dose, a little bit. So, because remember, your essentially the vaccine is giving you the option to be able to go through a heavyweight to a heavyweight match without getting bruised up. You know, so it's one of those things where, you know, I would say that, like, if you're having symptoms from the cold, you could just, you know, communicate with your healthcare provider and say, hey, you know, let me recover a little bit, because, you know, sometimes the second dose of the vaccine, you know, you get rigors, you do get chills. And so one way to kind of think about it, you know, a more robust reaction means you're making more antibodies. So if you had like a meter to kind of say, hey, I got one antibody, like it's just your body action, a good reaction to the vaccine. You know, but if it's beyond reproach where you really not feeling well, as Guylaine, PA Guylaine mentioned, you want to be able to kind of, you know, reach out and get support and make sure you're not having anaphylactic reaction. And if ever in doubt, call 911.
Okay, thank you, Dr. Aristide, and thank you, KCL, for your question. The next question is from Marie Cherenfant. Sorry if I messed up the last name. She asked, do they check for list of medications that can pose a problem after taking the vaccine?
And so, you know, not routinely, you know, obviously, you know, things that, there are no medicines that's known to have a cross reaction, you know, with the vaccine at this point. One thing that they will probably want to know, obviously, if you're on high dose blood thinners, you should communicate that with the person giving a vaccine, because you may get a bigger bruise on the arm. You may get like a hematoma, like a little blood collection underneath the arm. In terms of, you know, if you're normally taking time to kind of help minimize the symptoms of the fever and the effect of the reaction, not adverse reaction, but a physiologic or normal reaction to a vaccine, right? So remember, you're being exposed to potential illness, with you're antibodies without illness. So, you know, remember, in life, nothing's free, right? So if all you have is a little fever, but don't get the lung damage, the kidney failure, the stroke, and you make your antibodies, that's probably a win-win.
Okay, and Dr. Aristide, as a follow-up to Marie's question, if someone is taking, you know, medication, should they be mindful of what time they take the medication and also what time they will get the vaccine? Should they be mindful of both of those times?
You know, like I said, just in terms of, there's no, because the vaccine is such a different mechanism, that I don't see anything where it pertain to, you know, routine medications, that's something where you have to change your pattern. Obviously, the only thing I can kind of think of is just being on heavy blood thinners. But if you're on blood thinner, it's probably because you're at risk of like atrial fibrillation, where you can get heart rhythm, where you can get stroke from, you know, where you have blood clots in the lungs or blood clots in the heart, or risk of a stroke. So for those reasons, I would never really advise for somebody to stop the blood thinners, because the needle is so small that it's unlikely to happen unless, you know, somebody's coming at you and their hand is all wobbly. In that case, you just tell them, you know, give me somebody else, you know, like that's the only time that I would say, you know, don't let anybody come in at you. If they seem like they're shaking, you know, as they come with the needle, that's a whole different question.
Okay. All right. On to the next question is from Claudia Sam. And she asks, are you allowed to select the vaccine of your choice?
In this situation, personal choice matters, but it really depends on geographically where you are, what's available, what's purchasing. But at this point, I would say all three are as efficacious. And unfortunately, you don't have that option as of right now. You know, to be able to kind of say, I want the Moderna. Obviously, you can look and see if you're going to go to different places that offers different things, but there's so much energy that goes into that, you know, with really won't really change the outcome. Like, I wouldn't advise you to put that degree of energy into that. I'll probably maybe, you know, find the next available vaccine, and that time, energy that it would take for you to kind of go around, maybe be an advocate, you know, take that time and educate somebody else that may not be there. You know what I'm saying? So use that time a little bit more efficiently. Or you can come and babysit my kids for the extra time if you like.
All right, all right. And thank you, Claudia, for the question. The next one is from Kitia again, and she asked, are there vaccination opportunities for people who are homebound, sorry? If so, where can this information be obtained?
Yes, the vaccination resources. There are a lot more providers who is now going into the community to provide it for those people who do qualify. So it's just a matter of communication, and so obviously the a logistical planning that's going to need to happen, but it is possible to be able to receive the vaccine, but obviously you're going to have to show and prove real merit, that you can't leave the house for sure, because obviously if you think about the amount of resources to come to everybody's house, it's going to be kind of tough to do so. Any municipality to be able to do that, so it's going to be kind of tough. So only for those who are there, to exercise that option. But I know increasingly more and more opportunity provided for people to receive vaccines who's not able to. So you could just speak with your local provider, your local town, city, and just see what those options are, and see what's available. And if you're not able to, then maybe coordinate with a loved one who will be able to kind of get you there, or planning, to maybe if you don't drive, have somebody who drive to take you. But just whatever it is, if you've come to the point where you're agreeable to take the vaccine for your safety, just reach out. People will reach out to reach back to help you.
Okay, great. The next one, I guess, is some information that was posted by Gina. She did say on March 22nd, the governor announced all New Yorkers 50 and older are now eligible for the vaccine. So we thank you for that information, Gina. The next question is from Colo, and he asked, how many of us need to take the vaccines in order to reach herd immunity?
There's no set number, but once you kind of get, like, at any point, once you start reaching a critical mass above 50 to 60%, that's when you kind of say it. But remember, when you talk about public health, you're talking about big numbers, right? You're not talking about individuals. You're not talking about Carlo, Guy will be protected, right? You're talking about just general numbers. Okay, you may go from 300 million people possibly being impacted to shrinking it down to 50 million, but that's still a big number. And so we just have to kind of do our work to be able to kind of improve those numbers in terms of the vaccination. But once you kind of get across the threshold above 60%, that's when you start reaching that goal. But it's not a hard number where you have to meet this goal. So keep in mind. So it's almost as if, let's put it like this. Imagine Kobe saying, how many jump shots do I need to take to be able to be clutch enough to hit, a shot at the end of the fourth quarter, right? You have to, put enough up to kind of improve that, but there's no guarantee. So the more you're able to kind of get into the win column, the more likely it's going to be, the better it is going to be. And even if you look recently, just in terms of the herd immunity that we got from, mumps and from being in the community, or chickenpox, right? When a small number of people started to decline taking those vaccines, guess what? Those things started climbing up again, right? And we're talking about small pockets throughout the city. And so it doesn't take much to lose the full benefit of most of us who are taking the vaccine.
Okay, thank you. And the next question is from Tadia. She's asking, why must people who get the vaccine still wear a mask?
I think it kind of goes back to Claudia's point. One thing is, if you kind of think about, if somebody's being vaccinated, right? Usually when you take the first dose of vaccine of the Pfizer and Moderna, that puts you roughly about 65 to 70% efficacy, right? And so you kind of want to make sure you don't expose yourself in the process while you're getting there, because no one says, hey, like, it's not like you check your blood sugar and say my blood sugar is 250. It's not like you're checking antibodies real time to say, hey, I have enough antibodies not to get sick. So until you get fully dosed and you build enough immunity, you should take general precaution. And one, I think it's also a matter of messaging, because there's plenty of people out there that's not vaccinated, right? And there's still some other funky stuff you can pick up too. And if you look, the rate of influenza is so low right now, was pretty much non-existent, right? Because we're wearing a mask, right? And so, to that question is, as more and more people get vaccinated, more and more people are protected, you'll be able to start removing the need for masks less and less, but we're not at that point yet, because we still need to do quite a bit of work. So I would still be disciplined, because remember, infectious control, preventative health is really like a continuum. There's no hard stop time, right? So you just do enough of it for enough of a long period of time where you're outside of that danger zone, right? Where there may still be some stragglers on either end, but the bulk of people will be protected. So always think about individual protection versus public protection. And so when it comes to the mask wearing, and that's why even now they say, hey, if you're gonna be in a small environment with people hasn't had any risk of COVID and you are vaccinated, you do not need to wear a mask. But obviously, if you go into the public, they do. But I think even that is a matter of messaging, to still say when you're in the public, because then, it's gonna get so murky. People just not wear a mask. Why is that person not wearing a mask? And they're gonna say, they're not gonna come to you and say, hey, why are you not wearing a mask? Did you take a vaccine? They'll just see you not wearing your mask and they'll put their guard down. But meanwhile, they didn't do anything to be in a privileged position that you are, who took the vaccine. So it's a matter of protecting other people from themselves sometimes, So, just put something nice on the mask,
All right, good advice. Okay, Tadia actually follow up with another question. She asked, I'm sorry, one second. Okay, sorry about that. Okay, she did follow up with another question. For the people who say, I'm waiting to see what the vaccine does, do you think in a year from now, the success or non-success rate of the vaccine will change?
What I would say is, right now, the success of the vaccine is kind of known, right? One example that I've shared with someone before is, if you had an elite soldier come from Afghanistan, come from Iraq, and he's in Times Square, he says, you know what? I remember seeing someone like this behave this way before there was a suicide bombing. You would take their advice, right? You wouldn't necessarily want to wait until that actually happens, right? And so, to the point about the vaccine is, there's enough data right now to be comfortable to do it for the immediate risk that you have, right? Because what you want to do, risk stratification, right? So if you're out in an event, right, there's different things. There's things that you need to do immediately when you're in that club or in that event, and there's an immediate stress like run, go hide. And there's something that you do when you're outside, and there's something that you do when you're home, right? So to try to act like what you would do at home, right, when somebody's actively swinging and throwing bottles, is very different. So try not to have people confuse the two in terms of what you do, because right now the immediate effect is X. And so for what we know, just in terms of the immediate short-term impact is there, and the potential risk of mitigated, I think it's safe. And I myself, as a vaccine recipient, and I'm an advocate for vaccine, and there's going to be different people of different ideas, but just kind of think of the people that lost their lives. That's the only way that I can kind of put it. And is that sometimes, you don't need to kind of know of, contracting a disease to kind of know that contraception works, right? So sometimes you want to be able to kind of keep things simple. And also, one thing to add is the same way people try to use that for the vaccine, no one knows what the long-term effects of COVID is, okay? What is COVID gonna do to your lung function, what it does to your cardiac function, what it does to your kidney function, and what the long-term effects are, right? We know it kills you in the short term, and no one knows what the long-term effects are. So it's, one can make the argument on both sides, but the more feet above ground, the more of our people that's above ground, that's the only argument that I need. Fight today and we'll figure out another strategy down the line.
Okay, great. Thank you. We will be taking I'm going to be asking just a couple more questions as we get ready to wrap up. So we do apologize if anyone has any questions that hasn't been answered. Dr. Aristide's information was posted on the chat, and I will say it again, just in case if your question was not answered tonight. The email is garistide15@gmail.com. It is spelled GAR as in Robert, I-S as in Sam, T as in Tom, ID as in David, E15@gmail.com. And you can also call them at 917-682-5301. Again, we just taken a couple more questions, and we do apologize for any questions that haven't been answered on this Zoom. So continuing with the questions, Dr. JC Moore asked, for the small number of people who do have a bad reaction, how is it handled, not just medically, but financially?
You're talking about litigation. So in terms of the reaction is, if you're an asthmatic, if you have what they call bronchospasm, if the allergic reaction is managed medically, one, by being able to manage it, typically how the immune response, sometimes they get epinephrine, Benadryl, they give Pepcid, just things to kind of help to, and again, the allergic reaction is basically your immune cells behaving similar to the cytokine storm that the COVID reaction causes, right? And that's why we're noticing now genetics matter. And genetics matter is, even though we both may be the same height, same build, same everything, but genetically I may have a predisposition that was hidden and unlocked that, may cause me to have a reaction that I don't know. But for that small number of people with reaction, that is managed medically and it's fairly safe. And that's why anytime you have a reaction that's longer than expected, reach out for help. At any point, call 911 to kind of get to an area where they can provide full support. Don't try to drink some T-Gingerm at home and hopefully it goes away. So the idea is that in terms of the litigation, honestly, that's not something that I know. In terms of that, I haven't been able to kind of put any energy to that aspect, but I could imagine anyone with a reaction to any kind of product. Obviously, when you take any kind of medicine, they'll discuss the risk and benefit, and there's like an applied consent that you give that may likely, because they do express to you that you may have an allergic reaction, but once you've given consent, it's likely that it's that. In terms of what maybe down the line, I couldn't tell what that is, but that's all I can kind of comment on that for now.
And to add to JC's question, there's also some information on the CDC.gov that deals with long-term effect. Like if somebody were to get complication long-term or detrimental, they have also a segment on the CDC.gov that deal with that in terms of help available, federal help. So there's that's one way we can reach out for the potential outcome that's so severe enough that we need means to deal with it.
Okay, great, thank you. And JC, I do see that you ask follow-up questions. I ask you to please send them to Dr. Aristide through the Gmail that we just posted. Our Assistant Nadine Nadim, I'm sorry, just posted his information, so you're more than welcome to contact him. I guess the last question that I have is from Anani. Before that, though, Nadine also posted some information for the homebound people that are seeking vaccination information for seniors or their loved ones. She posts that they can sign up for the homebound shots by calling 877-VAX, and that's VAX 4NYC, and that's the number 4 NYC, or go online at vax4nyc.nyc.gov. I'll be posting that to the chat right now as well. So on to the last question. That last question was from Anani, and she wrote, I understand that there are more vaccines available, but why is it so difficult to get an appointment to get the vaccine?
I think specifically, I think it's gotten easier in terms of making vaccines available. I think that we're going through the different phases of providing essential workers, healthcare professionals. Now I think there are people at risk, and now I think they're up to teachers. And so I think it was just mostly a logistics. And obviously, we think of ourselves as an individual, but remember, this is a city of, close to 9 million people at this point, right? And so, and it's a significant amount of stress on the system to be able to kind of do that. So what I would recommend is, just like some people drive into our neighborhoods to, take vaccine availability, just look a little broadly, if you're okay for that drive to an area that may be having like less concentration, and see if you can take the vaccine there. So those are kind of things I would kind of employ you to do.
Okay, great. Thank you. So this ends the Q&A segment. I myself, I want to personally thank, Dr. Aristide and PA Aristide, as this information has been, it's great information and resources that have been provided to us. I've learned many things tonight, which I didn't know anything about. So I do appreciate you guys, and I do thank you guys for taking your time to inform the community. Okay.
It was my pleasure, and I'm really thankful that we're able to kind of take advantage of this forum. And again, it kind of goes to the hard work and commitment that you guys have put in over the past many decades of providing, support to the community pre-pandemic. And so, it's people like you who make it possible to infuse this information in structures like this, because without this, it will make it a lot harder to kind of, create that dispel all that misinformation that exists. So, I just want to commend you guys also for being great leaders in the community, for doing great things over the many years. And I hope you guys can continue to stay engaged and help your community to stay safe. So great job to you guys as well.
Thank you so much. Thank you so much, Dr. Aristide. I want to let you guys know that this Zoom was recorded, and we will be making it available on our COVID page, right, Mano?
Yes.
We can make it available on our COVID page, and he'll be posting that as well on the chat, because I think it's very useful, and I think you guys are welcome to share with others in your community. And our website is radaka.org/humanitarian. I think Manu will be posting that for you guys, and we will try to make it available also on Facebook. So we'll stream it at some point, and you guys are welcome to like forward it and share it to as many people as possible, because this is really the hope. And I also want to add that this presentation was solely made possible
by Dr. Aristide from his willingness to help the community. It was not sponsored by any of the pharmaceutical. We were not sponsored by Pfizer, not by Moderna, not by Jensen. And it's all really because we really, yeah, guy.
Actually, I was sponsored by Patekode. You know, Mr. Need Patekode, so she
That
will
was
be
my
hooking me up.
only, this guy is so addicted to pate corde, that's the only way to get him to do anything for me, you know? So I'm gonna make you pate corde. He loved that also. He calls it Haitian caviar.
That's right. Haitian caviar.
So I owe him some pate corde. I'm very good actually. So Guy, I mean, from the bottom of our heart, I don't know how much to say thank you for what you did tonight. You make us very proud, you know, to know that there are people like you making a difference day in, day out in the community, but that we're not even aware of. So we say thank you. We want to salute all our providers in the audience. Dr. Yvette Edouard, thank you so much for being with us. We want to say hi to Claudine, our RT, you know, and everyone else, because I cannot really glance at the pictures. And Joe, hi Marta, hi guys. We want to say hi so much. So happy that you all were able to join. And our Holy Innocents community, thank you for joining. And the information is available, and all of us can share it, you know, for whoever could not make it, because we know it's Saturday night, it's the day before Palm Sunday, it's kind of heavy, but it's going to be there for you guys to disseminate in your community. So we say thank you. We also want to say hi. I think Carmel is here. Carlo told me hi, even though I can see pictures, but I want to say hi to all our out-of-state people. Anani, I can't go into it because we have to wrap up. It's 28, we're going to close at 9:30. To my team, my humanitarian team, I don't know what to say. I want to say thank you to my assistant, Nadine Aspilea. Nadine, say hi to the people. Very quiet, but so powerhouse in terms of information. I'm so proud to have her on the team of Humanitaire Radaka. And she was able to really facilitate all of that in a sense, flyers, promotion, and thank you, thank you, thank you. And then I want to say thank you to everyone else, Veo, Innocent, who really help us with the Zoom setup. And I don't want to name names because I'll get in trouble. Our humanitarian team is like about 13 people, even though most of them could not be, even though most of them could not be on tonight, but they worked very hard to make it, to bring it to fruition. Thank you so much. And Mano, my moderator, my host, my everything tonight, you did such a wonderful job, such a wonderful job. And we say thank you. Thank you so much. We are so blessed to have you. And to all of you who tuned in and showed up, we say thank you. And there'll be more coming, because I really feel like we have to really do this very often, more often, because there's so much a need for information out there. Okay. And somebody posted that now they're finally taking out some of those fake information on the internet. It's about time, because with freedom of speech, people don't even have to validate what they're saying. I may wake up today, I want to say something, I post it, and it becomes some kind of information. So at least now they're realizing some of the damage that was done, and they're trying to clean it up. But it's a little bit late, but nonetheless needed. Thank you so much for everyone who joined in. And I want to say hi to Michelle from Canada, Michelle Bertrand. I know some people posted for me on Facebook. I want to say thank you, because we're not that socially inclined, but we have people surrounding us. We have our Tadia, who also did a good job in posting for us. So we want to say thank you to everyone. If I start saying thank you, we'll never be done. So good night. Good night.
Right. Everyone stay safe.
Wait for us. Yeah. Thank you so much. So I'll see you all very soon. Good night, Dr. Guy. Good night, Emmanuel. Good night.
All right. Thank you. Thank you, everyone. Have a good night.
Good night. Take care, everyone.
Thank you for Carlo, who's sponsoring us at SDN. Thank you. Good night.
Thank you.
Bye, everyone. So I'm going to stop the recording now, Shay, right?
No, Something about